Hello, I'm Jennifer Garapi, the pet therapist. I tell you what your pet would say if they could talk. So today we're going to talk about gastric ulcers in dogs and cats. And this is part one of a twofer. So today we're going to talk about what exactly an ulcer is and what causes them. And then in part two, we're going to talk about how to hopefully prevent ulcers and also how to treat them. So what does your dog or cat want you to know about ulcers? Well, first of all, an ulcer is formed in the stomach or in the duodenum. And the duodenum is the first part of the small intestine that leads away from the stomach. And dogs will tell you that unfortunately they are much more likely to get an ulcer than a cat is. So let's talk about the stomach and what it looks like to have an ulcer. So the stomach of cats and dogs is just brilliantly designed, if we do say so ourselves. And the reason it's so brilliantly designed is because the level of acid in the stomach is super high. On a pH level, it's 1.0 to 2.5. And what this means is that it will destroy just about anything you put in it. And that's super great because by nature, we are scavengers. And so if we eat raw meat that's been contaminated, or we eat something that has pathological bacteria, or sometimes one of our favorite things, if we eat poop, those things are all going to be killed off before they can hurt us. So a ulcer forms when the amount of acid, though, in the stomach gets so high that it overcomes the protective mechanisms of the lining of the stomach or the duodenum. And the stomach or the duodenum are protected by a couple things. Won't go into all of them, but for example, one of them is a thick mucus layer. And another one is an increased blood flow to the area, which means that as cells are damaged, they can quickly be replaced. But again, that layer can quickly be eroded if the amount of acid gets even higher than it normally is. So what causes these ulcers? Well, there are various reasons, for example, different diseases or infections, but the top three reasons are the ones that we want to talk about today. So top reason number one is overprescription of NSAIDs and also steroids. Now, if I have any sort of inflammatory condition like allergies or arthritis, my vet might put me on NSAIDs or steroids in order to combat that inflation. The second most common reason is accidental poisoning. So if I lick up some coolant on the floor of the garage, for example, or you put out pesticides in the yard, or you use any type of toxic cleaner in the house, in my natural process of grooming, I'm going to be licking that off my skin because I'm not wearing shoes, right? So there aren't any shoes to protect me from these contaminants. And then the third most common reason is something called a Helicobacter infection. And a Helicobacter infection is formed secondary to an unhealthy GI tract. Now, how do you know if I have an ulcer? Well, it can be really hard to tell, especially in cats, because often there aren't any symptoms until it's really severe. But I'm going to tell you what to look for. So anemia, a lowered appetite, weight loss, weakness, rapid heart rate, bloody vomiting, a dark tarry stool, abdominal pain or nausea. And you can tell if I'm nauseated often because I lick my lips and because I drool. Now, what I want you to know for one thing is that if I am on long-term steroids or anti-inflammatories, these are absolutely going to cause damage to my GI tract, just as they do in you guys, humans. And so if I'm on them for a short period of time, it's probably okay, unless I'm super sensitive, but long term, if you take me to a vet that is going to put me on these long term, and I don't have a life-threatening condition that requires me to be on them, then at the very least, I suggest that you insist to the vet that they give me some kind of protectant to protect that lining of my stomach and my duodenum. And I would also suggest that if that's all my vet is recommending to you is this long-term use of these drugs, that you actually find me another vet, because there are a lot of other amazing options out there that are non-toxic and far more healthy for me. And I think that's all I want to tell you today. So let's wait until next time. As I said, this is a twofer, and the next